When you think of cancer treatment, you commonly think of chemotherapy. What you may not have heard of are vaccinations available for cancer. There are two major classes of cancer vaccines, the first being prophylactic vaccines, which are preventative and keep healthy people from getting sick, much like a vaccination against hepatitis B. And the second being therapeutic vaccines, which have the ability to treat patients already diagnosed with cancer. This presentation will be focusing on the use of therapeutic vaccines. Therapeutic cancer vaccines are designed to eradicate cancerous cells by strengthening a patient's own immune response. They do this by attacking and destroying cancerous cells while leaving healthy cells intact. Doing so, these vaccines inhibit further growth of advanced cancers and relapsed tumors. Based on their method of synthesis and how they work, we can classify cancer vaccines into three categories. The first being tumor cell vaccines, second, peptide vaccines, and third, dendritic cell vaccines. In tumor cell vaccines, the tumor cells are isolated from a patient, irradiated, and then combined with an immunostimulatory adjuvant. The adjuvant serves the purpose of boosting the immune response in the hopes of creating a longer-lasting protection, which in turn helps to minimize regrowth of cancer cells. This concoction is then administered to the individual from which the tumor cells came from, usually via an intramuscular injection. Some of the advantages of tumor cell vaccines would be that you're presenting a tumor directly to your immune system, and also that the method for synthesizing the vaccine is very cost-effective. On the flip side, this method requires a large amount of sample to stimulate an immune response. In addition to that, it only works with certain cancers. Complications can begin to arise with cancers in hard-to-reach places. In peptide vaccines, epitopes that are expressed on the surface of tumor cells are identified and isolated. Epitopes are kind of like cellular fingerprints that our immune system has the ability to recognize. Once isolated, these epitopes are paired up to immunostimulatory adjuvants and injected back into the patient from which the epitopes came from. Some of the advantages of peptide vaccines include the fact that they are easily synthesized, inexpensive, and have a low chance at inducing autoimmunity. On the other hand, the disadvantages of peptide vaccines would be that they're rapidly degraded, and they also require a large amount of peptide in order to induce an immune response. For dendritic cell vaccines, blood is drawn from a patient and centrifuged. Centrifugation allows you to separate the components of the blood based on different densities. A layer called the buffy coat is isolated, as it contains almost exclusively white blood cells that can become dendritic cells. Dendritic cells are immune cells that act as teachers and educate developing immune cells in the body called cytotoxic T cells. Blood-derived dendritic cells are then partnered up to tumor epitopes and injected back into the patient. Once inside the body, these dendritic cells literally show the epitopes to developing cytotoxic T cells, priming them to destroy any tumor cells in the body expressing that epitope. These vaccines are resistant to breakdown in the blood, and they're also very immunogenic. On the other hand, this method is very labor-intensive and expensive.